Are you feeling stressed? Struggling to sleep? Having muscles twitching? Menstrual cramps? Or energy crashing halfway through your day? You might be missing a powerful mineral, magnesium. More specifically, magnesium glycinate. It was believed that magnesium is a cofactor in over 300 enzyme systems. However, recent scientific research has expanded this number to more than 600 enzymes that regulate critical biochemical reactions such as protein synthesis, muscle and nerve function, blood glucose control, and blood pressure regulation. But it's important to understand that magnesium comes in a lot of different forms, so if we look at what magnesium glycinate really is, it's really a combination of magnesium and the amino acid glycine together combined, and when you combine these two, you get a much better absorption in the intestine. While using other type of magnesium that's not well absorbed like magnesium oxide or sulfate or carbonate or even magnesium hydroxide, those are all poorly absorbed. Let's talk about the unique health benefits of magnesium glycinate. Number 1, it reduces anxiety and stress. By modulating the nervous system, magnesium glycinate can alleviate symptoms of anxiety and promote a sense of calm. A study published in Neuropharmacology linked magnesium deficiency with increased anxiety behaviors in animals, which were reversed after supplementation. Magnesium supplementation, especially glycinate due to its high bioavailability, may help modulate the HPA axis and reduce cortisol levels, aiding in stress resilience. Number 2, it improves sleep quality and insomnia. Magnesium glycinate has been shown to improve sleep quality by regulating neurotransmitters and reducing cortisol levels, the hormone associated with stress. Research shows that magnesium supplementation can improve insomnia symptoms, especially in older adults. Glycine on its own has shown benefits for sleep latency, time it takes to fall asleep, and combining it with magnesium enhances those effects. Number 3, it supports muscle and nerve function. Magnesium is crucial for muscle contraction and nerve signal transmission. It also prevents excessive excitation of neurons that can lead to cramps, spasms, or twitching. Studies have found that magnesium glycinate can reduce muscle cramps and improve neuromuscular control, especially in athletes and older individuals. It may also alleviate symptoms of restless leg syndrome and fibromyalgia by modulating calcium flow in nerve cells. Number 4, it promotes cardiovascular health. Magnesium regulates blood pressure, maintains normal heart rhythm, and prevents calcification of blood vessels. The glycine component also exhibits anti-inflammatory properties, further aiding vascular health. Clinical studies have shown that regular magnesium intake is linked to a lower risk of hypertension and cardiovascular events. Magnesium glycinate, specifically, due to its absorption and tolerance, is often used in long-term supplementation protocols for heart health. Number 5, it regulates blood sugar and lower diabetes risk. Magnesium glycinate can improve insulin sensitivity, aiding in blood sugar control for individuals with type 2 diabetes. A meta-analysis found that magnesium supplementation improves insulin sensitivity and glucose control in both diabetic and pre-diabetic individuals. Glycinate's form allows for better absorption in people with gastrointestinal issues, which is common in diabetes, thereby enhancing its efficacy. Number 6, it supports bone health. Magnesium is essential for converting vitamin D into its active form, which helps regulate calcium absorption, all vital for bone density and integrity. Magnesium deficiency is correlated with lower bone mineral density and increased risk of osteoporosis, especially in postmenopausal women. Supplementing with magnesium glycinate can help maintain healthy magnesium levels, supporting bone formation and mineralization. Number 7, it reduces symptoms of PMS and menstrual cramps. Magnesium helps reduce inflammation and regulate mood-affecting neurotransmitters like serotonin. Glycine adds muscle relaxant effects. Several trials report that magnesium supplementation can reduce PMS symptoms, including mood swings, bloating, and cramps. Glycine enhances the effect by calming uterine contractions and supporting sleep, both crucial during the luteal phase. Number 8, it reduces the frequency of migraine headaches. People who experience migraine sometimes have low magnesium levels in their blood and tissues. Supplements can help reduce the frequency of migraine headaches. There is strong evidence that magnesium deficiency is much more prevalent in migraine sufferers than in healthy controls. In addition, some other important benefits include Magnesium also helps balance the levels of calcium, copper, zinc, potassium, vitamin D, and other important nutrients in your body. And it aids the transport of calcium and potassium ions across cell membranes. This helps your nerves send signals, your muscles to contract, and your heart to beat in a normal, steady rhythm. Let's talk about the daily dosage. Typical daily recommendations for adults are 350 milligrams for women and 400 to 420 milligrams for men. Magnesium glycinate is gentle on the stomach, so it can be taken with or without food. However, people with sensitive stomachs or those prone to gastrointestinal issues may prefer taking it with meals to reduce any risk of discomfort. The best time to take magnesium glycinate is based on the purpose, as below. For sleep support, take 30 to 60 minutes before bed. For stress and anxiety relief, take either in the morning or bedtime. For muscle recovery or performance, take in the morning with meals. For general wellness, take same time daily, choose your time. Regardless of timing, consistency is key. Pick a time that aligns with your routine and stick with it daily. Magnesium works best when levels are maintained over time. Now let's talk about the side effects of magnesium glycinate. While it's generally well tolerated, it can still cause side effects, especially at high doses or with prolonged use. Common side effects. These side effects are generally mild and occur primarily when magnesium glycinate is taken in large quantities. Diarrhea, one of the most common side effects of magnesium supplements due to their osmotic activity in the gut. Although glycinate is gentler than magnesium oxide or citrate, it can still cause loose stools in some people. Stomach upset, including bloating, gas, or cramping, especially if taken without food. Nausea and abdominal discomfort. These symptoms typically subside if the dose is reduced or taken with meals. Serious side effects, rare. While rare, high doses of magnesium glycinate, especially above 350 milligrams per day from supplements, can cause more severe reactions, particularly in people with kidney problems, hypotension. Low blood pressure. Excess magnesium can cause the blood vessels to relax too much, leading to a dangerous drop in blood pressure. Heart disturbances, including irregular heartbeat or even cardiac arrest in extreme overdose cases, although this is very rare in healthy individuals. Confusion, lethargy, and slowed breathing, signs of magnesium toxicity that require immediate medical attention. Who should be cautious? Magnesium glycinate may not be appropriate or should be used with medical supervision in the following groups: people with kidney disease. Reduced kidney function hampers magnesium excretion, increasing the risk of toxicity. Individuals taking certain medications, such as diuretics, antibiotics, heart medications. These can interact with magnesium and either increase or decrease its levels in the body. Remember, magnesium glycinate is considered one of the safer and more effective magnesium forms. However, like any supplement, it carries risks if misused or if underlying health issues are present. Consulting a healthcare provider before starting magnesium glycinate is essential, especially if you're pregnant, breastfeeding, or on other medications. Medical disclaimer: the information provided in this video content is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. If you find this video helpful, please give us a thumbs up, subscribe to our channel, and don't forget to hit that notification bell and share with your friends. Thank you for watching, take care, and we'll see you in our next video.